I would like to invite Dr. Vijay Govindaraj from Vellore to the stage. He will speak on Mastering OSA Anatomy, a clinical revisit of upper airway structures.
Good morning, everyone. Warm welcome to all of them for coming to Ranipet KH Apollo, the second year, and to all the special doctors, my well-wishers. The topic given to me is Mastering OSA Anatomy. If you master anatomy itself, OSA is thing. And what the general public is talking about OSA is over-snoring fellow. Then I told them it's obstructive sleep apnea. Every time that fellow is snoring too much, I think it's over-snoring fellow. Then we thought, okay, it's not like that, and the subject is growing at unaccountable pace. Everyone's newer generation wants to take up this, and they have to learn more about it now. What we are thinking is only tonsils removal and only DNS correction is over. Things have been changed. I'll again go back to basics, as I was always a basic student here. The word entertainment starts with ENT and ends with ENT. ENT plays a key role in that. Let us learn ENT as easy as entertainment. To understand the planes of section, I have just created this easy way. Just cutting a ball with the axe like this, and that becomes A for axial section, S for straight, S for sagittal section, and C for the letter corona. So it is coronal section. With this, anyone gets the concept of what is this axial, sagittal, coronal. With these basic concepts only PGs and the upcoming doctors will come to understand where the concept and what is this surgery they want to go into later on. So everything in ENT is small, so we can have to zoom into to make our understanding bigger and better. So this is what my camera taught me initially, and that's what I'm also going to teach. That's what I have also learned now. No zoom. Without zoom, we get a picture like this with my camera. This is how the patient's history is. I'm just snoring, sir. So then there is something there. That's what our idea is. Next is I zoom little with 25x camera. Can you all see something there? Yeah, it's like the doctor's impression. Okay, the problem is not in the nose area, it is in the larynx area or pharynx area. Then comes the 50x zoom. The same camera, same place I am in, I have not moved. So this is the doctor's examination. We do some investigation or anti-rhinoscopy or ideal, whatever we do. Next comes 100x zoom, the same camera, same place. These are investigations we get to do. And finally 200x zoom, same camera, and your diagnosis. So with this concept to make understanding, ENT understanding easy, I've created sketch diagrams which will help you all to instantly draw and show the patient. Rather than talking about CT, MRI and other pictures, you can instantly draw and show that. And the other one is hand model. Hand model to understand the concept of what we are going to do, what we are going to do with the patient. The patient understanding better than what we are thinking it is. So draw your own sketch lateral diagram of the larynx and pharynx. I'll go rush little fast because the time given to me is very short. So this is how the diagram starts, and we'll fill everything in this diagram. Nasal cavity, nasopharynx, oral cavity, oropharynx, larynx, the area behind larynx, laryngopharynx, or also called as hypopharynx. Then is trachea, then is esophagus. The main areas, 8 areas of the upper aerodigestive tract. And I put the skin to make it look better. And the parts of pharynx also has been showed, nasopharynx, oropharynx, laryngopharynx. This is the airway. The air takes a passage like this. At oropharynx, it takes a turn, goes into larynx. And this is a foot passage, which takes a turn. And the oropharynx plays a very key role in this because it's a transaction of both food and air. So with this concept, I fill all the areas with the important structures like tracheal rings, vocal cord, anything above vocal cord. This area is called glottis. Anything above that is called as supraglottis. Below that is called subglottis. So the 3 areas of larynx has been shown very easily. Supraglottis, glottis and subglottis. Epiglottis is the cap above, and false vocal cord has been put. Between that is ventricle. Then is subglottis. Then hyoid bone on lateral sagittal section look like a dot. Then the tongue, 2 parts of tongue, anterior 2/3 and posterior 1/3. Then the space between the tongue and lingual surface of epiglottis is called as vallicula. Lower jaw, upper jaw, hard palate, soft palate, and all the 3 terminates in the lateral wall, and the posterior pharyngeal wall extending from the base of skull to pharyngoesophageal junction, and the adenoids present in the nasopharynx, eustachian tube opening, torus tubaris, eustachian tube opening, and the fossa of Rosenmuller present there, tubal tonsil, and in oropharynx we are putting the anterior pillar, posterior pillar, tonsils. The lining epithelium of upper airway tract, very important here. All the epithelium has been marked in the same areas which we have just told now. So what are the advantages of these sketch diagrams in OSA? For example, if this is a diagram which we are having, we can always enlarge, adenoids can be shown, elongated uvula can be shown, falling back enlarged tongue, or enlarged or floppy epiglottis can be shown, and subglottic stenosis can be shown, supraglottic tumor, glottic tumor, subglottic tumor, transglottic tumor, or post-cricoid growth, antroconal polyp, ethimoidal polyp, everything in one particular easy sketch diagram which I have developed, and this is just to show what we are going to put. Even to anesthetists it's useful, and to the patients also. We are going to use this kind of anesthesia for you, and even tracheostomy if needed has to be explained to them in a very easy way, that we are putting the tube in the airway and not exceeding it backward. So make your own hand model now. From sketch diagram I am bringing that into hand model now for you all. So this is V for voice. We use a right hand, actually all of us use a right hand, there's no time, but you can simply try now. R for V for vocal cord, V for voice, and this becomes the patient's true vocal cord, and when you keep it towards you, this becomes ours, left side and right side, and when you turn it towards the patient who's sitting in front of you, it is the right side and left side for them. You can show vocal cord palsy, everything in this hand model, and this is adduction, abduction, and deep inspiration, and this is during expiration. So this area of the vocal cord is called as glottis, and anything above that is called supraglottis, anything below that is called subglottis. And I take a paper, small paper, roll it, fold it, and make our own larynx with the left hand, place it in position, and turn it, and you can make your own larynx. Left hand, you can just bring it towards you like a thumbs up, and your larynx is ready. Why this is so important is, you can easily able to explain to any patient what condition they are in. So these are all the marks which we make with the pen to just make the students and PGs understand about what larynx is and what is supraglottis, what is supraglottic vestibule. And this is the patient side when we turn, and this is how the students also learn with ideal. So larynx continues as trachea, we know that, and in larynx I have kept the white paper which shows vocal cord, and that area is called glottis, and the area above that is supraglottis, below that is subglottis. And now place your hands to make the tongue and valvula very easy. This is very, very easy. Your left hand like this and your right hand like this. Anything you can show. The tongue falling back during sleep which causes the snoring can be easily explained with this. And this is the larynx which I shown you all. And this is the trachea. This is V is the region valvula, and this is tongue, anterior 2/3, posterior 1/3. And these are the parts of oropharynx and oral cavity here. Now I am going to show you the left hand, which is the larynx. I am placing it like this towards me. I want to show you hypopharynx, the most important region, neglected region, because it's always collapse, opens only during swallowing. So we keep like this and take your right hand and place it behind, and you get this, all the parts. Right side pyriform fossa, left side pyriform fossa, posterior pharyngeal wall, and this region behind the larynx is called as post-cricoid region. All the four important regions shown in hand model, and once they understand this, you will exactly know where is the foot pipe and windpipe, that is trachea and esophagus. So I place the hand like this, keep two pens, just to make people understand that these two tracks are totally different, and larynx continues as trachea, hypopharynx continues as esophagus. So now we make the whole pharynx, all the 8 parts, into your hand model, which I created for you all. And we take the right hand, all of you can keep your right hand like this, you can use your right hand, and this becomes the posterior pharyngeal wall, and your larynx is ready, left hand, you place it here, not here, not here, not here. This is nasopharynx, this is oropharynx, this is hypopharynx, and your structure becomes ready by now. Larynx, I put a pen there, that is trachea, then I put a pen in the space between hypopharynx, and that is esophagus. Then I put the tongue right in front of the larynx, that is a tongue. Anterior 2/3, posterior 1/3 is marked to show you all, and valvula is there, very important. Foreign body, common area for foreign body oral cavity, oropharynx. And I put the hand to show the mandible. Then hard palate and soft palate. And the nasal cavity. And now, just to make it look more systematic for you all, I have erased this side and hope it looks like the lateral view of the face. Nasal cavity, nasopharynx, oral cavity, oropharynx, larynx, laryngopharynx, trachea, esophagus. So what is so important about this is, now you will have understood 3 concepts. If I give an X-ray to you all, easily you all can tell me all the parts easily. First, draw the hard palate. Take a line on the hard palate. Anything above hard palate is nasal cavity, behind that is nasopharynx, below is oral cavity, and all your parts are done with this. You can easily get to read X-rays or even sagittal sections of skull. and all the three has been compared to you, sketch diagram, hand model, and lateral view. The understanding becomes better. So what your eyes couldn't see, your mind couldn't tell. What your hands could teach, your mind could definitely tell. So in sleep endoscopy, velum is the retropalatal region. Next is oropharyngeal lateral wall seen in the oropharyngeal region. And the next one is tongue base and the epiglottic region. So with this concept, you can understand what they're talking about: lateral diameter, AP diameter, circumferential diameter. No one has an idea when we tell about that, what classification or whatever we are talking about. But once you get to understand this, you can easily show, and we can also explain to ourselves before doing the surgery. So this is the concept which, and during swallowing what happens, I've just briefed it out to you with the hand model, what all we can show. Even swallowing I've done, but this basic diagram where tongue pushes against hard palate, soft palate lifts and closes the foot to enter nasopharynx, and epiglottis closes the laryngeal inlet, and larynx is pulled forward and upward. Passavant's ridge is formed in the posterior wall. Very important. This is what happens during swallowing. If you enjoyed this, this is how others enjoy learning with hand models. The coronal section of the nasal cavity, and this is the facial nerve. This is the whole ear hand model, all parts of ear, external ear, middle ear, inner ear. And this is the osteometal complex of the lateral wall hand model, and this is the cut section of the cochlea, and the modulus also has been done for you all. And this is the internal auditory meatus hand model, larynx paper model. This is my tympanic Ganesha, which I drew as a PG. And the word entertainment starts with ENT and ends with ENT. ENT plays a key role in that. Let us learn ENT as an entertainment. I want to thank my family, teachers, students, friends, patients, well-wishers, medical colleges for the continuous support for me to come up to the stage. And special thanks for all of you for lending me a ear. Thank you.
So thank you, sir. It was really wonderful. Thank you so much, sir.
Yes.
Thank you, doctor. Be on the stage, please. I request chairpersons to come to the stage. I request Dr. Kashmira Kumawat and Dr. Vignesh to join to the stage. I request chairpersons to honor the doctors.